Stay healthy in the hospital. The steps to maintain a clean hospital room, proper hand hygiene, and how to prevent infection after surgery. Coming up next.
During your hospital stay, a clean and sanitized hospital room is critical for preventing the development or spread of healthcare-associated infections, or HAIs.
This happens with daily disinfection and cleaning that's performed by a specially trained environmental services technician. These environmental services, or EVS professionals as they're called, will come into your room daily and they'll supplement the cleaning efforts that might be done by your nurse.
The role of these individuals is incredibly important to your safety and your well-being. They are not just there to make sure you have a shiny floor. They are there to ensure the health of your room.
So it's important to let an environmental services professional clean your room when they ask to do so.
They have very specific types of activities that will occur for disinfection of your room, of your bed, of your bathroom, of the sink that is used for hand hygiene purposes. So they will use a variety of products. They are using disinfectants that are specifically targeting microorganisms in the healthcare facility. That is going to be very important and critical work that is safety work for you.
But keeping a clean room is your job too, as a patient or a family member.
One of the most important things that you can do to help environmental services keep your room clean is to keep your environment decluttered. Don't bring extra things into the hospital. This is one of the reasons we don't, for example, like live plants in healthcare, because of the risk that they create. So you can help us help you by keeping your areas around you as clean as possible.
This is key work for you. This is for your safety.
When Mom's doctor said she shouldn't live alone anymore, we needed a plan for assisted living fast. Luckily, she told me about a place for Mom, where an advisor answered all of our questions, like what type of care does Mom need? What will it cost? What communities have availability? My senior living advisor provided options and quickly set up tours that helped us make the right decision, a decision Mom and I both feel good about.
Our service comes at no cost to your family. Connect with us today.
After surgery, you are not at full strength. Your body needs time to heal and repair itself. When you are in this weakened state, your risk of developing an infection increases, and an infection can complicate your recovery and put your overall health at risk. You can develop an infection from the spread of germs, and germs are everywhere, from a cough or sneeze traveling through the air, on the surfaces you touch, even in the hospital. The best way to prevent the spread of germs is to wash your hands often, before and after you eat, after you use the restroom, before you leave your room and when you come back, before and after touching any of your bandages and dressings, and after you come in contact with another person. Use soap and warm running water. Vigorously scrub all surfaces, including your palms, the backs of your hands, between your fingers, your thumbs, and on your fingertips and under your nails. Scrub for at least 15 to 20 seconds every time. If soap and water are not available, you can still wash your hands. Use alcohol-based hand sanitizer. Alcohol-based hand sanitizer can actually kill the germs it comes in contact with. But if your hands are dirty, the alcohol cannot reach the germs. So if you can see dirt on your hands, it is better to use soap and water. Visitors and hospital staff may carry germs with them as well. Protect yourself. Speak up and remind them to wash their hands each time they come into your room and each time they leave. In order to protect against germs, your bandages need to be changed on a regular basis, and the surgical site needs to be cleansed properly. If you notice your bandages are wet, dirty, or starting to come off, let hospital staff know so they can change them. And when hospital staff change your dressings or bandages, make sure they wash their hands before and after treating you, and that they are wearing proper protective equipment, like gloves. Tubes and catheters can increase your risk of developing an infection. The longer they are in your body, the more at risk you are. Talk to your healthcare provider about removing the tube or catheter as soon as possible. While it is in, make sure you follow your healthcare provider's instructions to keep it clean and sanitized. While you recover, watch for signs of infection, including fatigue. You may feel more and more tired each day instead of steadily getting better. A fever, chills, vomiting, or diarrhea. At the surgical site, you may notice the area feels hot and may be red. The area smells foul. Increased swelling around the incision area. Tenderness and soreness. And drainage from the wound site. If you do notice any of these signs of infection, tell your healthcare provider right away. The faster your infection is treated, the faster you can get back on the road to recovery. Pneumonia is another type of infection that you may be at an increased risk of after surgery. Pneumonia is a buildup of fluid in the lungs and can be serious. To strengthen your lungs and prevent pneumonia, your healthcare provider will prescribe specific breathing exercises called incentive spirometry and controlled coughing. Perform these exercises as directed, but expect to do them about 10 times each hour. If you feel pain while doing your breathing exercises, talk to your healthcare provider about proper pain management to help you reach your controlled coughing goals. Doing your breathing exercises as directed can help clear your lungs of excess fluids, helping you breathe easier, feel better, and prevent infection.
Getting and keeping track of your immunizations will help keep you and those around you healthy. Follow this checklist to ensure that you are staying up to date with the vaccines you need. Do get a flu vaccine every year. The flu vaccine is given as a shot for many and is available as a nasal spray for some. Do get a Tdap booster every 10 years if you are over the age of 19. You probably got the child version of the vaccine called DTaP. but you will need a booster to continue to protect against diphtheria, tetanus, and whooping cough. Do get a shingles vaccine if you are over 50 and healthy. This will be given in 2 doses over 6 months. Do get a pneumococcal vaccine if you are over 65. There are 2 different pneumococcal vaccines, so check with your healthcare provider to make sure you receive the vaccines you need. Do keep a record of all immunizations you receive, including boosters. This will help you to know if you are up to date. Do talk to your healthcare provider about any other vaccinations that you may need, especially if you are a healthcare worker or are traveling outside of the U.S. Do not skip your needed vaccines because you are feeling well. Getting immunizations as needed is a big part of the reason you are feeling well and healthy. Talk to your healthcare provider and get the recommended immunizations to help lower the risk of disease for you, your loved ones, and your community.
Staying healthy can sometimes feel like you're navigating a challenging game.
Health risk increasing. Sanitizer selected.
When you think you're in a zone where there are bacteria around, there are ways to combat it.
Congratulations, you protected yourself from bacteria. Bonus point awarded. Level up.
Hi, Diego. Your grandmother's exam is almost over.
Okay, great.
Have you gotten your flu shot this season? We are having a walk-in clinic for patients to get them today. You can be infectious with the flu before symptoms start.
Yep, I got this year's flu shot before the semester started.
Congratulations! By having a flu shot, you protected yourself and others. Double bonus points awarded. Level up.
I'm so glad to see you. You didn't have to skip class, did you?
No, Nana. My C++ programming class doesn't start till 6.
Oh, goodness. It's like you're speaking another language.
Exactly.
Warning. Virus detected.
I'll be right back. Excuse me. My Nana just got admitted and a visitor in her room is coughing. I don't want her catching anything. Would you be able to give that person a mask?
Okay. Thanks for letting me know. I'll bring them a mask to wear and ask them to keep it on until they leave the hospital. You are doing a great job taking care of your grandma.
Congratulations! By speaking up, you are helping to keep yourself, your loved ones, and other patients safe. Triple bonus points awarded. Level up. Help prevent the spread of diseases like the flu and pneumonia. When you are sick, cover your mouth and sneeze into your elbow. Stay a safe distance from others or wear a mask in public places. And don't visit family and friends in the hospital or anyone whose immune system may be limited. Whenever possible, take a sick day to keep everyone healthy. Infection prevention is not really a game. Don't risk it. Speak up to prevent infection.
You're watching the Patient Channel.
Now, a Health Minute. Deaths from heart disease have been falling since the mid-1960s, but experts disagree on the reason why. Some credit healthier lifestyles, others advances in treatment. It's already known that aspirin itself can help prevent heart attacks. A study in the American Journal of Public Health theorizes food rich in salicylates, compounds like the active ingredient in aspirin, may have the same effect. Some foods, including oranges, cherries, raisins, and tomatoes, are naturally rich in salicylates. Talk to your healthcare provider about adding more foods that are natural sources of salicylate as part of your heart-healthy lifestyle.
It's simple, easy, and one of the best ways to keep yourself from getting an infection. Cleaning your hands.
Hand hygiene is the most important thing that both you, as the patient, and your healthcare team can do to reduce the risk for infection.
As a patient, it's okay to ask your healthcare provider if they've washed their hands or used hand sanitizer.
Anytime a healthcare provider comes in and enters your room, whether they're wearing scrubs or a hospital badge, it's okay to speak up and say, please stop and wash your hands before you care for me.
Loved ones should also wash or sanitize their hands when they visit you. And make sure you're cleaning your own hands before eating and after going to the bathroom, even if you can't move on your own.
We can also bring you a wet washcloth with soap and water in a basin, but regardless of where you are or your physical state, feel comfortable asking us to bring hand hygiene for you. You should have it anytime, anywhere.
Hand sanitizer is another option, but only if you follow these directions.
Anytime your hands are visibly soiled, or anytime you know that you have come in direct contact with blood or a body fluid, there's no substitute for a soap and water hand wash. Most every other time, the most appropriate hand hygiene process is going to be using an alcohol-based hand rub. It's easy to use, it works quickly, and you can do that while you're doing many other tasks.
Make sure you are using hand sanitizer correctly.
You want to use the right amount. You want to use enough to actually fully cover all the areas on your hands, between your fingers and palms and top of your hands. You also want to make sure that you allow it to dry. And we do that by saying just keep your hands moving, keep rubbing them until it dries.
Keeping your hands clean is easy, but if it's done incorrectly, germs will stay on your hands.
It's important that you wet your hands first, that you apply soap, and make sure that soap then comes in contact with all the surfaces of your hand. What you're trying to do is get that soap to actually pull those organisms up off of the skin of your hands, so your water will wash them away and wash them down the drain.
If you've used soap and water to wash your hands, be sure to dry your hands when you're done. A bloodstream infection can occur when germs enter your body through a catheter or the entry site of a catheter. A catheter is a tube that's placed into your body and then into your blood vessel.
And we place those catheters in order to maybe deliver life-saving fluids, antibiotics, or other medications.
There are actually two kinds of catheters, peripheral and central.
A peripheral catheter is the type that you typically see that's inserted into the hand or the forearm, whereas a central catheter is inserted into the larger blood vessels further up in your system that actually go directly into the heart. These tubes can become infected, despite what we try to do, and can actually cause an infection within your bloodstream.
So where does the infection come from?
Many times bloodstream infections come from the patient's own bacteria on the skin.
To keep germs out of your bloodstream, hospital staff will take certain precautions, beginning at the time that the catheter is inserted.
So you may see your healthcare provider wearing things like a sterile gown or sterile gloves or a mask.
Also, before the catheter is placed, your skin must be free of all germs.
One of the ways that we do this is to use what's called a skin antiseptic. These antiseptics come in the form of things like alcohol, or you might have heard of chlorhexidine gluconate, and these are all recommended to reduce your risk for infection.
Above all, hand hygiene is the single most important thing your care team can do to reduce your risk of infection whenever working with those intravenous catheters.
It's important that sometimes during procedures we'll have to stop and perform hand hygiene between to make sure we reduce the risk for contamination or infection.
In addition, there are many things you can do as a patient to prevent bloodstream infection.
Number one, you should always have clean hands. Clean hands are everybody's responsibility. It's not just your healthcare worker. You as a patient should have opportunity to have your hands washed. Your family members or visitors, they should cleanse their hands both before they come in the room to visit you, but also when they are leaving the room to either visit others or to go home.
And don't be afraid to ask questions such as, have you washed or cleaned your hands? How long will I need this catheter? Is there anything I can do to speed up the removal of the catheter?
So remember that we are all working for you. When you are in a healthcare facility, you are the most important thing to us. So let us help you by making sure that you understand and that you're fully engaged.
Antibiotics aren't always the answer. Antibiotics save lives, but many times they are prescribed when they aren't really needed. Antibiotics are only needed for treating certain infections caused by bacteria. Antibiotics do not work on viruses, such as those that cause colds and the flu. When you're given antibiotics when they aren't needed, they won't help you, and the side effects could still hurt you. To learn more, visit www.cdc.gov/antibiotic-use.
Interested in extra cash? Be entered to win a gift card when you complete a 5-minute online survey. We'd like to know your opinions about the programs you've been watching on this channel. Your feedback will be used to ensure patients continue to get the best information possible about health and wellness. Please go to the link shown or text HEALTH to 411-247 to complete this survey to be entered to win a gift card.
Staphylococcus aureus, or Staph aureus, is a bacteria that is commonly found on the skin. MRSA is a type of Staph aureus that is drug-resistant.
It stands for methicillin-resistant Staphylococcus aureus, which is a fancy term for resistant staph bacteria.
Identifying MRSA fast and getting it treated quickly is very important.
MRSA, like other multi-drug resistant organisms, can be resistant to many antibiotics that we have in our arsenal to take care of you. Unfortunately, in some cases, they can become resistant to all known antibiotics, which can lead to death. And so it's important that we properly treat you with the right antibiotic to take care of you promptly.
Many MRSA infections occur in people who've been in hospitals or other healthcare settings.
And it can come from basic things like environmental surfaces or the hands of your healthcare provider. And therefore, we need to be alert for things that look like skin and soft tissue infections.
MRSA bacteria can cause the skin to look red, swollen, warm, and can be painful to the touch. MRSA in other body sites, such as the bloodstream or in surgical wounds, can cause severe illness. MRSA can be spread in several ways, including on the hands of patients and healthcare workers that have not been adequately cleaned.
The first and most common is the contaminated hands of the healthcare team, and that's why hand hygiene is so vitally important. The second way we need to think about is actually from the environment that's around you during your hospitalization. So things like bedside tables, the phone, the call light that you use to call your nurse, and finally from your own skin. And so it's pretty naturally occurring in the environment, and therefore sometimes you may actually have this naturally present on your own skin.
To prevent the spread of infection, it's also important for healthcare workers to make sure wounds are covered at all times.
We want to make sure that any microorganisms that may be either colonized or part of an infection in that wound are not able to come in contact and then be transmitted via the environment or via the hands of someone else. So for your protection and as well as others, always maintain any type of draining wound covered.
As a patient or a visitor, you can also help stop the spread of MRSA.
Number 1, clean hands. Always clean hands. Anything that you touch should be done so with clean hands. You and your family member and your healthcare worker.
At every healthcare facility, there's also a specially trained team that makes sure your room is not only clean, but free of harmful bacteria.
This is why when someone comes in from environmental services to clean your room, many times they will ask you, is it okay if I clean your room now? We want you to always say yes and enable them to maintain your environment so we can reduce the number of those microorganisms that are around you so that you are then not able to touch them and move them to other of your body sites.
chain reaction called sepsis. Very quickly, sepsis can cause tissue damage, organ failure, and even death. If you know the risks, can spot the symptoms, and act fast, then you can get ahead of sepsis. Learn more at cdc.gov/sepsis. You can get ahead of sepsis. Learn more at cdc.gov/sepsis.
Where and how you store your medications is important to make sure they stay at their prescribed strength, ensure they are taken by the right person, and keep everyone, including children and pets in your house, safe. Follow this checklist to store medications properly. Do store medications in a dark, dry place that is not too hot or too cold. Do store medications in the refrigerator, but only if your prescription says to do so. Do store medications on different shelves or different locations in your home for each person that takes medications. This way, everyone knows where their own specific medications are located, and no one will take the wrong medication by accident. Do color code the bottles for each person taking medication in your house so there isn't any mix-up. You can do this with special bottles or by putting a colored ribbon, hairband, or tie around the bottle. Do store medications with the lid tightly secured. Do use child-resistant caps and place medications up high where children can't reach them if you have kids in your home. Do check the expiration dates on your medications. Safely discard any expired medications. Do not take them or give them away. You can take expired medications to your doctor's office or pharmacist for safe disposal. Do not store medications in your bathroom, where moisture can affect the strength of your medication. Do not store medications in a car, where it can be too hot or too cold. You may take medications for only a short time, or you may take them for a lifetime. Pay careful attention to the way you store your medications. Follow this checklist to correctly store your medications to help you take them safely and effectively.
It's really been a gift having Mom live with us, but as a nurse, my training told me she needed more help than I could provide. So I connected with a place for Mom. My senior living advisor understood our unique situation. She quickly recommended communities and set up tours. A place for Mom helped us get to a decision. And now, Mom is so well cared for.
Our service comes at no cost to your family. Connect with us today.
Are you enjoying what you're watching? Access this program and much more online. Simply look for the website printed on your program guide, checklist, or bookmark. Today's health tip. You can help prevent germs from becoming superbugs. Take antibiotics safely. Only take antibiotics prescribed to you. Never share antibiotics with anyone else. Complete your prescription unless your doctor tells you to stop. For more information on superbugs, go to www.nih.gov.
Healthy eating may be the most important tool you have in managing your diabetes. It can make blood glucose management easier because what you eat has an immediate effect on your blood glucose level. Here's why. When you eat, most of the food is turned into glucose, a form of sugar,
which enters the bloodstream. If you choose foods that cause your blood glucose to rise too high, and it remains high over time, health problems may develop. By making healthy food choices, you can bring your blood glucose into a healthy range and keep it there. Healthy eating can help you lose weight or maintain a healthy weight, which can also improve your blood glucose and reduce the complications of diabetes, like heart disease, kidney disease, and eye disease. And if you exercise regularly along with making healthy food choices, you may find you need less medication. So, what are these healthful food choices? Everyone can benefit from choosing from a wide variety of fresh, unprocessed foods or minimally processed foods like vegetables, whole grain breads and pastas, beans, nuts and seeds, fruits, fat-free or low-fat milk and cheeses, and lean cuts of meat like fish, chicken or turkey breast, or loin and round cuts of beef or pork. Certain types of cold water fish, like tuna and salmon, are also rich sources of heart-healthy omega-3 fats. But making these changes isn't easy. Take some time now to think about your lifestyle and diabetes management, and how meal planning can help the food choices you make fit into your management plan. Is there a place in your lifestyle where you can focus on making small changes to help bring your blood glucose into a healthy range? If you aren't sure about how to make healthy food choices, meet with a registered dietitian. A registered dietitian can help you learn what foods are healthier than others and give you some tips and tricks to help make healthy eating a part of your life. To see how your food choices affect your diabetes, you need to monitor your blood glucose. It's the only way to know whether your food choices are benefiting you. You and your diabetes care team can decide when you should be checking your blood glucose and how often. Write down the results of each test and share them with your healthcare provider. Healthy food choices will affect your blood glucose results in a positive way. Once you learn about the endless possibilities of delicious healthy foods, you'll grab a spoon, fork, chopsticks, whatever it takes to start eating for your diabetes health. Although diabetes is complex, it's manageable when you have the right information and support. Diabetes educators are trained to be your diabetes expert and can help you learn how to successfully thrive with diabetes. You deserve nothing less. Ask your provider for a referral today. Find one at www.diabeteseducator.org/find.
Today's health tip. A 12-ounce can of regular cola contains 9 to 10 teaspoons of sugar. Supersize it to 32 ounces and you're drinking over 20 teaspoons of sugar. Eating too much sugar can increase your risk of obesity, type 2 diabetes, and heart disease. Look for ways to reduce the amount of sugar you eat in order to stay healthy.
After you have a heart attack, you're always worried that you're going to have another one. My LDL was a little high. When did I find out that it was a problem? Not until probably I had my heart attack. I was put on a heart-healthy diet, and my cholesterol was the same. So my cardiologist said, you know, there's this drug, Repatha.
Do not take Repatha if you are allergic to it. Repatha can cause serious allergic reactions. Signs include trouble breathing or swallowing, or swelling of the face. Most common side effects include runny nose, sore throat, common cold symptoms, flu or flu-like symptoms, back pain, high blood sugar, and redness, pain, or bruising at the injection site.
And they repeated the blood work, dropped to 45. Just like that. I mean, it was amazing. You realize that you're here for other people. It isn't just your issue.
Dad needed a place where he would no longer be living alone. We needed a senior living community that could best care for Dad's progressing memory loss. A place where Mom had the experience to guide us. My senior living advisor understood our needs, recommended a range of memory care communities, and was with us every step of the way. It gave us confidence in our decision. Now Dad's getting the special care that he needs.
Our service comes at no cost to your family. Connect with us today.
When you have diabetes and are trying to make healthy food choices, it's important to choose carbohydrates wisely. Carbohydrates are found in 3 key groups of foods. Starchy foods, which include breads, whole grains, pasta, rice, noodles, some vegetables like corn and potatoes, and beans. Fruits, and dairy. Carbohydrate is also found in table sugar, syrup, and most processed foods like crackers, pretzels, chips, candy, and desserts. Most of the carbohydrate you eat is turned into glucose and used by your body for energy. Carbohydrate raises your blood glucose more than any other type of food. That's why if you eat too much carbohydrate, your blood glucose may rise to unhealthy levels. Foods high in sugar or processed with white flour, like cakes, cookies, pies, candies, and desserts, are usually high in carbohydrate. These should be enjoyed only in small amounts because they usually offer less fiber and little nutritional value and can raise your blood glucose quickly. But since your body needs carbohydrates for energy, cutting them out altogether is not an option. Instead, make your carbohydrate choices healthy. Fruits and non-starchy vegetables are 2 healthier food choices. Most people today need to eat more of both. In fact, it's recommended that you get 2.5 to 3 cups of non-starchy vegetables each day, and depending on your carbohydrate needs, 1.5 to 2 cups of fruit. These give you some of the nutrients your body needs for energy and overall health.
I love a vegetable, and especially foods like corn and potatoes. Well, they are high in carbs, so I had to decrease those and do a lot of spinach, broccoli, and so forth.
To get the fruits and vegetables you need each day, try cutting up vegetables ahead of time and snacking on them during the day. Try a side salad with a meal. Or choose canned fruit as an affordable way to take it and go. Just be careful of juices and fruit packed in syrup. They may be adding more sugar than you need. When in doubt, fresh fruit is always the better choice.
Consider using fruit, for example, as a dessert and knowing it doesn't always have to be raw. It could be heated where the natural sweetness of the fruit gets enhanced, like baked apples or even lightly warming blueberries. They become like a jammy kind of thing.
Another great way to get your daily carbohydrates is through whole grains and legumes. These carbohydrate choices can be high in fiber, which tend to fill you up and help you feel full longer, while not raising your blood glucose as fast as other carbohydrate foods. This is a benefit when trying to manage your diabetes. It is recommended that you get 25 to 35 grams of fiber each day. Choose high-fiber carbohydrates like whole grain pasta, pasta containing bean or legume flour, or brown rice, corn, or quinoa. Look for cereal made from whole grains. Work with your healthcare provider to find more healthy carbohydrate choices that fit into your lifestyle. Although diabetes is complex, it's manageable when you have the right information and support. Diabetes educators are trained to be your diabetes expert and can help you learn how to successfully thrive with diabetes. You deserve nothing less. Ask your provider for a referral today. Find one at www.diabeteseducator.org/find.
Interested in extra cash? Be entered to win a gift card when you complete a 5-minute online survey. We'd like to know your opinions about the programs you've been watching on this channel. Your feedback will be used to ensure patients continue to get the best information possible about health and wellness. Please go to the link shown or text HEALTH to 411-247 to complete this survey to be entered to win a gift card.
It takes less than 1 minute to find out if you may have prediabetes, and you can do it here. So what are you waiting for? Just go to the site.
Your heart is at the heart of everything you do. And if you have heart failure, there's a medicine specifically made for heart failure, Entresto. It's a heart failure medicine prescribed by most cardiologists. Entresto is proven superior at helping people stay alive and out of the hospital. Heart failure can change the structure of your heart, so it may not work as well. Entresto helps improve your heart's ability to pump blood to the body. And with a healthier heart, there's no telling where life may take you. Don't take Entresto if pregnant. It can cause harm or death to an unborn baby. Don't take Entresto with an ACE inhibitor or aliskiren, or if you've had angioedema with an ACE or ARB. The most serious side effects are angioedema, low blood pressure, kidney problems, or high blood potassium. Ask your doctor about Entresto for heart failure, and trust your heart to Entresto.
One key to making healthy food choices is to choose fats wisely. There are healthy fats which our bodies need, and there are fats that can hurt our health. Healthy fats called monounsaturated and polyunsaturated fats can actually help lower your risk of heart disease, a major concern for people with diabetes. It is recommended that you get 20 to 35% of your daily calories from monounsaturated fats. You will find monounsaturated fats in olive oil, canola oil, nuts and nut butters, olives, and avocados. Polyunsaturated fats can be found in sesame, sunflower, safflower, and corn oils, walnuts, soy nuts, and soy protein products, and fatty fish such as herring, salmon, mackerel, tuna, sardines, and swordfish.
For the fat it has, for those things that are the fatty fish, the omega-3 fats have been shown to be very protective for heart and even brain and mood.
To get the benefit of these good fats, add a few nuts or seeds to the foods you choose. Use olive oil or canola oil to prepare your foods. Try a slice of avocado on top of your salad. Talk with your diabetes care team to find out which foods can give you the benefits of healthy fat.
Things like avocados and olives and nuts, delicious and nutritious, satisfying, can be used as a snack or as a part of a meal.
You still want to pay attention to the serving size for healthy fats, as they can be high in calories. At the same time, reduce the amount of saturated fats you eat. Saturated fats can increase your risk of heart disease. These can be found in foods that come from animals, like beef, lamb, pork, and dairy products. Your goal should be to have less than 10% of your calories from saturated fats. Eat less of foods high in saturated fats. Choose lean meats like chicken breast and seafood, and bake, broil, or grill instead of frying. And take advantage of the low-fat or reduced-fat foods out there. Choose 1% or skim milk instead of whole milk. You might like the reduced-fat salad dressings if you give them a try. Be careful though. Some foods advertise lower fat, but actually increase the sugar to get the same flavor. That can mean more carbohydrates and calories than you expect. Talk to your healthcare provider about changes you can make when choosing foods with fat. Start with one change today. You can increase the healthy fats you eat, reduce bad fats like saturated fats, and switch to reduced fat or low-fat versions of your favorite foods. By selecting healthy fats each day, you can increase your overall health for the better. Although diabetes is complex, it's manageable when you have the right information and support. Diabetes educators are trained to be your diabetes expert and can help you learn how to successfully thrive with diabetes. You deserve nothing less. Ask your provider for a referral today. Find one at www.diabeteseducator.org/find.
Dropped to 45. Just like that. I mean, it was amazing. You realize that you're here for other people. It isn't just your issue.
Everyone can benefit from preparing foods in a healthful way, whether you have diabetes or not.
Yeah, I always enjoyed cooking, but now it's a little different when you really look at the carbohydrates and the sodium and really look more for the nutritional value.
When you're in the kitchen cooking, prepare your meat by removing any excess fat before you cook it, including the skin on chicken. If you normally fry food, try broiling, steaming, grilling, or baking your foods. This cuts down on fat, which is good for your diabetes and weight management.
Well, some of the healthy ways to cook are things that involve keeping the freshness of the food and the taste and flavor vibrant. And I think of those as steaming, baking, roasting, even pan sauteing can be, depending on what it is.
If your busy schedule makes it hard to cook meals every day, try preparing healthy meals ahead of time and freeze them for easy reheating later. You will be less likely to reach for unhealthy processed foods or the takeout menu if a healthy meal is on hand.
I was talking with my aunts about, different foods and different books and things like that help you, and they're all excited. So we get together and we look through them and we plan meals and snacks and try this, try that.
Try the same for snacks. Cut up fresh vegetables or fruit ahead of time so they are easily within reach.
Right now,
the little plastic baggies is my friend because I'm able to portion out. And so by using that little snack one, there's been so much you can fit in there. So, which is a plus because then I know I'm limiting my snacks.
And you might be a good cook or like the kitchen, but we can all assemble healthy foods. Talk to your healthcare provider about more tricks you can try when preparing your meals at home. The next time you cook, think about healthy ways to prepare your food, because small changes can go a long way to controlling your blood glucose and your health. Although diabetes is complex, it's manageable when you have the right information and support. Diabetes educators are trained to be your diabetes expert and can help you learn how to successfully thrive with diabetes. You deserve nothing less. Ask your provider for a referral today. Find one at www.diabeteseducator.org/find.
Time for lunch!
Every tool has a purpose. You just have to use the right tool for the job. Antibiotics are the right tool to treat certain infections caused by bacteria. They are the wrong tool for viruses, such as colds and flu.
Sandwich, anyone?
When they aren't needed, antibiotics won't help you, and the side effects could still hurt you.
Time to make the bed.
Ask your doctor when an antibiotic is the right tool, and when it's not. Visit cdc.gov/antibiotic-u.
Your heart is at the heart of everything you do. And if you have heart failure, there's a medicine specifically made for heart failure, Entresto. It's a heart failure medicine prescribed by most cardiologists. Entresto is proven superior at helping people stay alive and out of the hospital. Heart failure can change the structure of your heart, so it may not work as well. Entresto helps improve your heart's ability to pump blood to the body. And with a healthier heart, there's no telling where life may take you. Don't take Entresto if pregnant. It can cause harm or death to an unborn baby. Don't take Entresto with an ACE inhibitor or aliskiren, or if you've had angioedema with an ACE or ARB. The most serious side effects are angioedema, low blood pressure, kidney problems, or high blood potassium. Ask your doctor about Entresto for heart failure, and trust your heart to Entresto. Your heart.
Are you enjoying what you're watching? Access this program and much more online. Simply look for the website printed on your program guide, checklist, or bookmark.
The information on this channel is intended to make you a better informed patient. It is not a substitute for professional medical advice, diagnosis, or treatment. You should not alter or discontinue any treatment without first consulting your physician or healthcare provider. Neither the Wellness Network nor this facility guarantee the accuracy of this channel's content and will not be liable for the use thereof. This channel is supported by product advertisements. The facility airing this channel does not endorse or have any financial interest in the advertised products.
When you have vascular disease, you are at a high risk for heart disease, peripheral artery disease or PAD, and stroke. Understanding vascular disease can help you lessen your risk for having a heart attack or stroke. Everything in your body, including your heart, lungs, and brain, is connected together by a vascular system or blood system. Blood travels through this system, delivering nutrients and vitamins to all of your organs, helping them to stay healthy and do their jobs. But over time, fatty substances can cause plaque to build up on the blood vessel walls anywhere in your vascular system. This is called atherosclerosis and can slow the blood flow throughout the body. Some people have no warning signs of atherosclerosis. Others have chest pain or numbness or pain in their hands or feet. As plaque builds up, blood flow is greatly reduced or even completely blocked. Blood clots can form. Both can lead to heart attack, stroke, or injuries that may result in amputation. While surgery and other procedures may be able to reopen the parts of the blood vessels that are clogged, they don't cure the problem. If you have had any blockages, you have a high risk of plaque forming in other parts of your vascular system. The best way to reduce your chances of developing blockages or suffering complications such as stroke, heart attack, PAD, or other serious health problems is to reduce the risk factors that lead to an unhealthy vascular system. Work with your healthcare provider to identify and help lessen your risk factors for vascular disease.
When Mom's doctor said she shouldn't live alone anymore, we needed a plan for assisted living fast. Luckily, she told me about a place for Mom, where an advisor answered all of our questions, like what type of care does Mom need? What will it cost? What communities have availability? My senior living advisor provided options and quickly set up tours that helped us make the right decision, a decision Mom and I both feel good about.
Our service comes at no cost to your family. Connect with us today.
Your heart is at the heart of everything you do. And if you have heart failure, there's a medicine specifically made for heart failure, Entresto. It's a heart failure medicine prescribed by most cardiologists. Entresto is proven superior at helping people stay alive and out of the hospital. Heart failure can change the structure of your heart, so it may not work as well. Entresto helps improve your heart's ability to pump blood to the body. And with a healthier heart, there's no telling where life may take you. Don't take Entresto if pregnant. It can cause harm or death to an unborn baby. Don't take Entresto with an ACE inhibitor or aliskiren, or if you've had angioedema with an ACE or ARB. The most serious side effects are angioedema, low blood pressure, kidney problems, or high blood potassium. Ask your doctor about Entresto for heart failure, and trust your heart to Entresto.
Your healthcare team will help you identify your vascular disease risk factors and how to reduce them. Some risk factors can't be changed. For others, you can make changes to lessen them. But it's important to identify all of your risk factors to create the best management plan for you. The risk factors you can't control include age. Your risk increases as you get older. Family history. If someone in your family has had a heart attack, stroke, or PAD, then you are also at risk. In fact, you have double the risk. Race. You are at a higher risk if you are African American, American Indian, Mexican American, or South Asian. Gender. Overall, a man has a greater risk of vascular disease, but a woman's risk increases after menopause. In fact, more women die of vascular disease each year than from breast cancer. And your medical history. If you have had blockages in your blood vessels, you are at higher risk for heart attack, stroke, and PAD. Make sure you share all of your medical history and known family medical history with your healthcare provider.